The NCLEX is not just testing if you memorized lab values, it is testing whether you understand what those lab values mean for patient safety. Because a lab value is not just a regular number. This can be your first clue that your patient is beginning to deteriorate. Today, let's review important lab values every nurse should know. The first on my list is sodium. A normal sodium is usually around 135 to 145. Sodium helps the body to control fluid, nerve function, muscle function, and a low sodium less than 135 can cause confusion, weakness, or even seizures. A high sodium greater than 145 can lead to dehydration or even affect the patient's mental status. Number two is potassium. The normal potassium is between 3.5 to 5.0. Potassium is very important for heart rhythm. A low potassium less than 3.5 or a high potassium greater than 4.5 can cause very dangerous cardiac arrhythmias. Number three is calcium. The normal calcium is usually around 8.5 to 10.5. We all know calcium supports bone health, muscles, nerves, and blood clotting. Low calcium may lead to muscle spasm, tingling, or even seizures. Number four is magnesium. A normal magnesium is usually around 1.7 to 2.2. Magnesium helps the heart rhythm become stable. Low magnesium can increase the risk for abnormal heart rhythms as well, especially when potassium is low. Number five, glucose. The normal fasting blood glucose is around 70 to 100. Low blood sugar can lead to sweating, confusion, seizure, loss of consciousness, while hyperglycemia or high blood sugar with diabetes can lead to diabetic complications. Number six is creatinine. This is usually around 0.6 to 1.3, and creatinine helps us to assess the kidney function. A high creatinine can be a sign that the kidneys are not filtering well. Number seven is BUN. BUN is around 7 to 20, and this can increase with dehydration, kidney problems, or increased protein breakdown. Number eight is hemoglobin. Hemoglobin carries oxygen in the blood, and a low hemoglobin may mean anemia, blood loss, which can reduce oxygen delivery to the tissues. Number nine is the white blood cell. A normal white blood cell is around 4,000 to 11,000, and a high white blood cell can be suggestive of infection, inflammation, sepsis, and number 10 is platelets. Platelets helps with blood clots, and a low platelets can increase the risk of bleeding. Very high platelets can increase the risk of clotting concerns depending on the patient's condition. Number 11 is INR. A normal INR is usually around 0.8 to 1.2. For patients on anticoagulation, a high INR means the blood is taking longer to clot, which increases bleeding risks. Number 12, lactate. A normal lactate is usually around 0.5 to 2.2. An elevated lactate can be very concerning for poor tissue perfusion, shock, or sepsis. So remember, do not just memorize lab values, understand what they mean, because when you recognize abnormal labs early, you can assess faster, report clearly, and support timely patient care. Thank you for watching. Bye.